Today, we'll be diving into the foundational concepts of nursing research. This chapter sets the stage for understanding how research informs and improves nursing practice, ultimately enhancing patient care. We'll explore what nursing research is, why it's essential, and how it guides evidence-based decisions in healthcare. Let's begin our journey into this important aspect of nursing. Nursing research is essentially a systematic inquiry aimed at answering important questions or solving problems that directly impact the nursing profession. Its goal is to produce trustworthy evidence that can improve nursing practice, education, and administration. Ultimately, this research helps build a unique and valuable body of knowledge specifically tailored to nursing. Nursing research plays a crucial role in improving patient care and health outcomes. It helps us understand complex health issues and develop evidence-based practices that ensure the highest quality of care. By exploring new knowledge, nursing research informs clinical decisions, shapes healthcare policies, and advances the nursing profession as a whole. Ultimately, its purpose is to enhance patient safety, promote well-being, and support effective healthcare delivery. The significance of nursing research lies in its fundamental role in improving clinical performance and ensuring patient care is based on solid evidence. This research helps build a unique body of knowledge that is essential for the profession, promoting accountability among nurses and maintaining high standards within the healthcare system. Ultimately, it supports the delivery of high quality care that patients can trust. Nursing research is incredibly important because it serves as the foundation for evidence-based practice, or EBP. This means that nurses use the best available research evidence combined with their clinical expertise and the values of their patients to make well-informed decisions about care. Rather than relying on tradition or guesswork, research ensures that nursing actions are both clinically appropriate and truly effective. This approach ultimately leads to better patient outcomes and higher quality care. The significance of nursing research is really centered around improving patient outcomes and ensuring cost effectiveness. One of the main goals is to enhance the health and quality of life for patients by identifying which nursing interventions actually lead to better results, like lower mortality rates, more effective symptom management, and improved functional abilities. This research also supports delivering care that is both clinically effective and financially justifiable, showing that good nursing practices can save costs while benefiting patients. The significance of nursing research touches on several key areas, but one of the most crucial is its impact on professional status and credential. In the United States, nursing research plays a vital role in establishing and maintaining credentials. For example, achieving magnet recognition, which is a prestigious designation for healthcare organizations, depends heavily on demonstrating a sustained commitment to nursing research and evidence-based practice. This emphasis on research not only elevates the status of nursing within healthcare, but also underscores nursing as an independent profession with its own unique scientific body of knowledge. This distinction is what helps nursing advance and maintain its credibility in the medical field. The significance of nursing research lies primarily in professional accountability and development. Engaging in research helps nurses uphold the core value of accountability by ensuring their practices are based on sound evidence. It also fosters a mindset of lifelong learning, encouraging nurses to critically evaluate new information and adjust their care as the evidence changes. Beyond this, being involved in research is not only intellectually stimulating, but also professionally fulfilling, adding depth and meaning to a nurse's career. The significance of nursing research goes beyond just clinical procedures. One key area is understanding human experiences. Qualitative nursing research provides deep insights into how people experience health and illness, which helps us deliver more sensitive and patient-centered care. It also enables us to address psychological and social aspects of health that aren't easily measured, but are just as crucial for comprehensive care. Nursing research plays a crucial role in shaping health policy and driving innovation. By providing evidence-based insights, it helps develop clinical practice guidelines that improve patient care. It also encourages creative solutions to persistent challenges, ultimately contributing to better health outcomes worldwide. Nursing research plays a crucial role in healthcare by helping us identify causes and prevent harm. By investigating factors that contribute to health issues, like infection risks, we can develop effective protocols. This kind of cause-probing research enables nurses to predict and control patient outcomes, which is essential for ensuring patient safety and improving overall care. The purpose of nursing research is really about addressing questions or solving problems that are important to the nursing profession. Through this systematic inquiry, we aim to generate trustworthy evidence that can significantly impact nursing practice, education, administration, and informatics. This evidence then guides improvements and innovations across all these areas. The specific purposes of nursing research can be understood through several frameworks, and one of the most common is the descriptive explanatory continuum. This framework helps us classify research goals based on the depth of explanation they offer. It starts with identification, where we recognize and define phenomena. Then, moving to description, which involves detailing characteristics and patterns. Exploration comes next, where new insights are sought through investigation. The process advances to explanation, where we seek to understand the underlying causes or reasons. Finally, at the prediction and control stage, research aims to anticipate outcomes and influence or manage conditions in practice. This continuum provides a structured way to understand the evolving goals of nursing research. Specifically, research is often organized around the clinical issues it tackles, such as therapy and treatment options, diagnosis and assessment methods, prognosis predictions, causes and potential harms, and understanding the meaning and processes behind health experiences. This classification helps ensure that the research directly informs and improves patient care decisions. When we talk about the purposes of nursing research, it's helpful to understand that they can be classified into two main types: basic research and applied research. Basic research is all about expanding our foundational knowledge, often just for the sake of learning more or to develop and improve theories. On the other hand, applied research is much more practical. It aims to find solutions to current problems and directly supports evidence-based practice, making a real difference in patient care. So, while basic research builds the groundwork, applied research puts that knowledge into action. The specific purposes of nursing research can be understood by examining different methodological goals. Quantitative research aims to apply the scientific method to gather numeric data that can be statistically analyzed and generalized to larger populations. On the other hand, qualitative research focuses on interpreting human experiences and understanding phenomena within their natural context, using subjective and narrative data. These two approaches reflect fundamentally different paradigms, but together enrich our understanding in nursing science. On this slide, we focus on the methodological foundations that underpin our approach. Understanding these foundations is crucial because they guide how we design our processes and ensure reliability in our results. We emphasize a structured framework that supports consistency and rigor throughout the project, which ultimately enhances the quality and credibility of our outcome. When we talk about the methodological foundations of research in nursing, we're really looking at two main paradigms. positivism, and constructivism. These worldviews shape how researchers design their studies and collect data. Positivism leads us to quantitative research, which focuses on numbers and measurable evidence, while constructivism guides qualitative research, emphasizing understanding experiences and meanings. Together, these approaches provide a comprehensive framework for nursing research. Quantitative research is rooted in the positivist paradigm, which means it assumes that there is an objective reality that we can observe and measure. This approach relies heavily on the scientific method, where we formulate hypotheses and test them through systematic data collection and analysis. We use deductive reasoning to move from general theories to specific observations, allowing us to draw conclusions that can be generalized to larger populations. A key strength of quantitative methods is the ability to maintain control over variables, ensuring that the results are reliable and valid. Understanding these elements is crucial for conducting rigorous and trustworthy research. When we talk about the qualitative method, we're looking at research grounded in the constructivist paradigm, which means reality is seen as multiple, subjective constructions instead of a single fixed entity. This approach embraces an emergent design, allowing the study to evolve as new data and interpretations unfold. Researchers use inductive reasoning, building theories from the ground up based on the information gathered. Also, in qualitative research, the researcher acts as an instrument, actively interpreting the data rather than just observing. Finally, we reach a point called saturation, where gathering more data no longer adds new insight. When we talk about research, we're referring to a systematic inquiry that uses disciplined methods to answer questions or solve problems, all aimed at expanding our knowledge. At the core of this process is empirical evidence, which means relying on observed and measured phenomena. Research also involves shared goals and constraints, ensuring that the work is focused and reliable. We distinguish between basic research, which seeks to increase fundamental understanding, and applied research, which aims to solve practical problems. Often, researchers use mixed methods, combining both qualitative and quantitative approaches, and triangulation to cross-verify results, ensuring their findings are robust and trustworthy. On this slide, we are focusing on the concept of levels of evidence. This is crucial because it helps us understand how reliable and strong the information or research findings are that we are looking at. Different studies and data sources carry varying weights depending on their design and methodology. By recognizing these levels, we can make better informed decisions and critically evaluate the quality of evidence backing any claims or recommendations. Keep this framework in mind as we move forward, as it will guide our interpretation of data throughout this presentation. The levels of evidence serve as a reliability ranking system that helps us determine how much trust we can place in the results of a research study. Essentially, it acts as a filter to reduce bias and ensure that the findings we rely on are more likely to be accurate and not just due to chance. The higher a study ranks within this system, the greater our confidence in its conclusion. Here we explore different types of evidence used in research, starting with opinions of expert committees and individual case reports. These provide insights but are often limited in scope. Moving on, single qualitative and descriptive studies focus on detailed observations within specific contexts, helping us understand experiences more deeply. Systematic reviews take this a step further by rigorously combining results from many high-quality studies to provide a comprehensive and reliable conclusion. That's what makes them so valuable in evidence-based practice. Observational studies, on the other hand, involve researchers simply watching what happens without intervening, giving us real-world insights but without control over variables. Quasi-experimental studies introduce treatments but lack random assignment, making their results less robust than randomized controlled trials, or RCTs. RCTs are considered the gold standard because participants are randomly assigned to groups, minimizing bias and ensuring the most trustworthy results. Altogether, understanding these different study designs helps us weigh evidence appropriately and make informed decisions. One crucial exception to keep in mind is that the best evidence really depends on the specific question you are asking. For treatment or safety questions, high-level randomized controlled trials, or RCTs, provide the most reliable data. However, when exploring questions about meaning or human response, a level 6 qualitative study can be more appropriate and valuable. This is because feelings and experiences can't be easily measured through experiments or lab tests, so qualitative research gives us deeper insight into those aspects. Understanding this distinction helps us choose the right type of evidence for the right question.